and gentlemen, it's indeed a pleasure to be part of this exercise, which has been so very well organized by the Department of Obstetrics and Gynecology of King Edward Medical University in collaboration with the Academy of Family Physicians. And as I entered the hall, I heard Dr. Tariq Mia enunciating the good work that this group of family physicians is doing, not only for family physicians but also for all levels of doctors and in all cadres. The topic that I am going to talk to you about is reproductive health challenges in Pakistan. And I think that it is a subject which relates not only with the specialty of obstetrics and gynecology, but it relates also very much with the family physicians. As a matter of fact, I think that it is the collective responsibility of all the doctors that in the context of our country's situation, that they relate themselves to this subject, as well as they contribute actively in improving the status of women in all respects in our country. The definition of health by WHO is not absence of disease but well-being, and that well-being is not only physical but mental and social well-being. So it is an all-encompassing concept of health, and within that, reproductive health is that component which involves the reproductive processes, functions and system, and not only during reproductive years, that is between 15 and 45 years of age, but throughout the life of a woman. The concept actually started back in 1994 when there was a conference in Cairo which was attended by most of the countries and with a very large number of delegates, and it was attended by all the governments, NGOs, etc. And they came out with the concept of reproductive health, and that is the definition which was at that time given to this subject. And four main topics, areas that were to be addressed through this related to universal education for everyone. One, that is, and secondly, reduction of infant and child mortality, which is very high in our country even now. Thirdly, reduction of maternal mortality. Pakistan still ranks quite high in that. And fourthly, also access to reproductive and sexual health services, including family planning. Now, if you look around, we are lagging behind in all these four parameters, and that conference was in 1994, 25 years ago. We still have a lot of ground to cover, a lot of work to do, and as doctors, I think that it is our responsibility to contribute in this area. Now, reproductive health components, if we look at it, start with adolescent health, in which nowadays HPV vaccination is important to prevent the development of carcinoma of the cervix. And we also have to educate our public on the social front about young age marriages. So far as reproductive years are concerned, starting with contraception and pre-pregnancy counseling and management of the pregnancy and then the delivery and birth. It also goes on to the postnatal care, post-abortion care, and sexually transmitted diseases and screening of diseases. So there is a whole lot of a list of topics which we need to cover. Then the perimenopausal age, when the ovarian function is waning, at that time there are psychosocial issues and then abnormalities of menstruation, and following that then there is menopause, during which time whether to give HRT or not and to which patients, and problems of related to osteoporosis, psychosocial and screening again. Along with that, there is this subject of sexual and reproductive rights, empowerment of women is important, and until and unless women are given empowerment, they are made to make decisions about themselves, the society is not going to actually progress. Now the situation in Pakistan, as I said at the outset, that we are all aware of that, but there are certain facts and figures which need to be reminded from time to time so that we know where we stand. In Pakistan, there is a huge bulge of population in comparatively younger age, and we see it all around, the population explosion. The number of births which are attended by skilled birth attendants is comparatively smaller. Sexual reproductive health is measured also by the prevalence of contraception within the society. We have a low contraceptive prevalence rate, and there is a huge unmet need of that. Education-wise, we have a lot of area to cover, and fertility is amongst the highest. As a matter of fact, it's the second highest in this region. All the other countries, India, Bangladesh, Sri Lanka, Nepal, Bhutan, etc., they have much lower fertility than ours, and that also affects the life expectancy. Now, if you look at this graph, it shows that we started in 1990 at 400. That was the maternal mortality ratio at that time, and we haven't really made. This green line shows the progress that Pakistan has made, but look at the other countries who have made tremendous progress, but we are kind of lagging behind. And a few years ago, the maternal mortality was estimated to be nearly 300 overall. Although the figure now quoted is less than 200, but we had a high maternal mortality, and one of the reasons was that the number of births attended by skilled birth attendants was very small, and we need to work on that. Then it is important, this particular slide, the information given on this is that almost half of the pregnancies that occur are unwanted pregnancies, which means because of lack of contraceptive use, the pregnancies are unwanted, and out of those unwanted pregnancies, a majority of them, they get terminated. And that results in almost 700,000 women seeking treatment, and that is the treatment for which record is available. The rest of them, about 2.2 million, they do not have any treatment, and that is the kind of magnitude we have of this. And these are the points which are important from the post-abortion care. According to one survey, more than 60% of women have their post-abortion care through the private sector, and family physicians play a large role in that. Till 1990, we did not have an independent Ministry of Population Welfare. And till 1960, the contraceptive prevalence rate was only 5%. By 1990, that rate rose to 12%, which was merely a 0.25% per year's increase. But then in the decade of 90s, that was probably one of the areas in which we progressed, and the contraceptive prevalence rate increased from 12 to 30%. But then again it stagnated, and we still are hovering a decade later around 30-35%. So this is an area where a lot of work needs to be done. And then you all know that in year 2000, Millennium Development Goals were formulated, in which all the countries were asked to reduce their maternal mortality. There were 8 different parameters, but there were 3 which were related to health, and 2 particularly relate to women's health. One was the reduction in child mortality, because that again is related to mother's health, and the second was improving maternal health. Unfortunately, we lagged behind that greatly. Even in the province of Punjab, which is considered to be better or more progressive than the rest of the country, in most of the indicators we were much behind. As a matter of fact, we weren't on track at all, and we lagged behind. And then in year 2015 came the SDGs, that is the Sustainable Development Goals, and 4 years have already passed, and the end point for that is 2030. So again, that's a wake-up call for all of us that we need to contribute to improving the health of women, because the objectives which relate directly to us are that by year 2030 reduce the global maternal mortality ratio to less than 70%, which in our instance is close to 200. We have to reduce it to about 70 per 100,000. And the preventable deaths of newborns under 5 have to be reduced considerably. Now, this is the kind of impact that the skilled birth attendants would make. That if 98% deliveries take place or they are conducted by skilled birth attendants, and 97% of them they are conducted in delivery, and then there is antenatal before that, the maternal mortality is very small in this. But just reducing the number to 47% or reducing the antenatal visits increases the maternal mortality to a great extent. Now, there is not a lot of technology which is required for this, and we only need to provide essential basic care, which most of the doctors and rather paramedical staff can provide. And for the training, we also do not need institutions. We only need our running hospitals where midwives can be given training for safe delivery, and by that we can reduce this maternal mortality. In 2018, unfortunately, this is UNICEF's report which showed that Pakistan was the riskiest place for the babies to be born, because our child mortality or neonatal mortality rate was very high. Amongst the top 10 countries, this is the highest neonatal mortality rate in the world. Now, not a figure to be proud about. So, if we look at all that, the problems and issues are that we have low contraceptive prevalence rate, we have a high unwanted pregnancy rate, almost 50% of the pregnancies are unwanted, and they lead to unsafe abortion and so much of misery and ill health for the women. And then we lack skilled birth attendants. There are untrained people who would be conducting deliveries, and postnatal care is almost non-existent. There is malnutrition and micronutrients. Only yesterday there was that news in the paper, because 2 days ago a survey report has come up which shows that 1/3 of our younger generation population is stunted. Their growth is stunted, and it is not only physical but it is also mental, and that has a lot to do with malnourishment and deficiency of micronutrients. And then the situation so far as reproductive and sexual rights of women are concerned, we hear every day so many news in the papers and on television which show the poor status of that. So these are the areas on which I would recommend, and I would implore all of you to pay attention and contribute wherever, in whichever capacity you can, so that we improve our health indicators concerning women's health, and to at least some respectable levels. I'll leave you with this thought by one of the Egyptian doctors who was president of FIGO some years ago, and the message that he says is that the women who are dying as a result of the process of pregnancy and childbirth, they are not dying because we do not have the technology to prevent those deaths, but because we do not have the will to do that. Thank you very much.